Unless I give the background, the question will have no relevance, sir. So, can the department make a request to the director RIMS to allot specific departments where we require specialists urgently? Say like radiologists.
Dr. Ampareen, Minister in charge, here to reply, please.
Honorable Speaker, sir. Reply to start question 85A, no, sir. B, sir, due to non-availability of trained doctors to operate and handle the equipments. C, yes, sir, government is committed to have X-ray and USG within the end of 2024. Doctors are currently being trained with the help of the government of Tamil Nadu for doing ultrasound sonography, sir.
Dr. Mijanur.
Mr. Speaker, sir, through you, I want to express my sincere thanks to Honorable Minister Health for her reply and her assurance that X-ray and USG will be provided maybe within the end of this year. May I know from the Honorable Minister in charge, what are the other routine tests that are available in Whiteberry CSC at present?
So what kind of tests are you talking about?
Maybe routine blood tests which are required for day-to-day diagnosis and investigation, like some blood, urine tests.
To my knowledge, we are yet to operationalize all of these facilities because we've just operationalized the building, sir, and we are going to install all of the necessary machines that are required, sir. It is not fully operational.
Mr. Speaker, sir, for the knowledge of the Honorable Minister, the following tests are at present carried out in Whiteberry CSC, that is hemoglobin, RBS, HbA1c, HIV, HbsAg, VDRL, urine not routine, only albumin, and sputum for AFB. Out of these tests, 6 tests are for maternity purpose, diagnosis when a patient is diagnosed as pregnant. So, as we all are aware that with the advancement of medical engineering technology, there are a lot of automated machines have come that which can provide us the basic routine tests without expertise. The machine can tell us the routine test. So may I ask or request the Honorable Minister in charge, then when these tests, especially like say a cell counter which can give us 10 parameters of a blood test or a urine routine test, so when can these facilities be available in the hospital?
Yes, sir. We have the basic rapid tests, like Doctor himself has said. But, sir, we need to strengthen this diagnostic center there because that is a commitment that we should achieve. In every CHC, we would like to have a routine, 64, 67 as per that list, if I remember. So now we will have to make sure that these automated machines are procured and we are on the job, sir. The new building now we've just shifted, sir, very recently. So we need to reorganize. I think doctor is well aware that we've just even managed to shift our operations to this new building. And surely we will ensure that all of these tests are also done.
I thank Honorable Minister in charge for her assurances, and at the same time, I request her humbly to provide these basic facilities which will ease off the problem of thousands of people of that area which this Whiteberry CSC is catering to. So this is my humble submission to her to provide these facilities at the earliest. And at the same time, though it is not pertaining to Whiteberry CSC, may I just ask her one question, that when is Kashiabari PSC, when it will be operational?
So that is, I will require notice for this, but I will make that information available. And yes, we have noted all the points that the Honorable MLA has himself said, sir.
Dr. Celestine.
Mr. Speaker, sir, in the course of the reply at B, sir, due to non-availability of trained doctors to operate and handle the equipments, we have the Regional Institute of Medical Sciences in Imphal. I studied MD there. The different states of Northeast who utilize that institute for in-service doctors to pursue further studies, they make special requests on the departments that they require most. For example, sometimes Meghalaya is offered MD in biochemistry, MD in physiology, or MD in anatomy, but whereas our requirements is MD in radiology, MD in general medicine.
Is this related to the primary question?
Yes, sir, it's related.
Please come to the question.
I'll come to the question. Unless I give the background, the question will have no relevance, sir. So, can the department make a request to the director RIMS to allot specific departments where we require specialists urgently? Say like radiologists or general medicine, so on and so forth, so that we can send our in-service doctors to these specific departments. Can the departments do that request?
So we will examine this matter.
Okay. Mr. Rupa Marak, please.
May I know from the Honorable Minister in charge, Health and Family Welfare, the staff pattern of Baitbari CHC?
So as far as staff is concerned, sir, we have a total of actually sanctioned posts there will be 5 doctors. We do not have those doctors at the moment there. And then we have 3 nurses, I think. So just give me some time. I'm just checking that document. Yes, sir. So we have a total staff sanction of 5, but right now we have 3 plus 1 Ayush doctor. We have 4 nursing staffs. We have 3 paramedical staffs. We have 2 ministerial or technical staffs. We have 1 driver, 4 A&M, 15 grade 4 staff, altogether 33. The total sanction strength is 34, but we have 33, sir.
One more, please.
May I know from the Minister in charge that who are the 3 doctors who are appointed in the CHC, Baitbari CHC?
Sir, if you want their names, then I will require notice, sir. But 3 doctors are there.